It's Philip Crowley here, National Director for Quality Improvement in the HSE. I'm here with Lloyd, Provost, statistician, improver, teacher. So we've lots of data. You've seen our performance report. We've an awful lot of information. How do you think what should we be prioritising so as we're measuring the right thing?
You know, if we look, we need data at lots of different levels. We need it at the frontline care processes, we need it in each of the hospitals, and we need it at the system level. And there's going to be, as far as learning, there's going to be different data needs at different levels there. And almost always at a system level, we're going to be aggregating the learning that goes on in the individual hospitals, the other care units to do that. So I think the question of prioritization should start, what do we need to control our processes for quality control at the local level? What do we need to improve our processes? And as we start, what data do we require to report and to aggregate and roll up? Put the emphasis on outcome data there. Try to keep the process data at the hospitals, at the local level where they can do things about it there. They need those, and they need to make sure they're controlled there. But what we'd like to see as we aggregate data, the more and more attention we can put to outcome measures, I think the better we're going to be on actually being able to use the data to make decisions and set the direction for the health system.
We've lots of tables of data in our performance report and in the various reports that we prepare. How do you think we should be displaying our data? Is there a better way of displaying data so we can use it for learning and for improvement?
Yeah, I think if all we're doing is reporting or complying, tables work fine. Okay. But if we need to learn, tables are not very good for learning. For learning, we need a picture, we need a graph of the data. And improvement, if we're focusing on improvement happens over time. And so temporal data is what we need. I need to know what happened in the past, what's happening now, and then I want to be able to predict what's going to happen in the future. That's what improvement's all about. And so we need time series displays of data. So almost all data, when it's being reviewed, should be looked at on a run chart, and some data should be converted to Shoe-Hart control charts. And Shoe-Hart control charts, I think, especially for data being reviewed at a management level, it's important because it can adjust for variation in sample sizes and other complexities. They can do case mix adjusting if we need to do that. But it's a general methodology that allows us to look at data over time and be able to use it for not just judgment, but also for saying, here's what we're learning from this. Here's the questions that are raised. Here's our opportunities for further improvement there.
So Lloyd, you know our health system, and you know it's under considerable pressures. In that kind of environment, what advice would you have for us as to how we can capture management's attention to focus it on quality?
Well, the expectation is, can we see some results here? So how can I actually design our first improvement initiatives, our place to go, that we can expect to get some results on something important to management then? So what are the management priorities? Do we have teams working on that at the right level? And design our tests so that we're working in areas that we're going to see some immediate results. Because I think results then are going to sell the idea to others. So once we start seeing results, we're going to say, I want more of this, willing to invest more in improvement, and we can continue to expand that way.
What would be your top tips for us here in the Irish Health System in relation to how we go forward in measurement?
Okay. So one thing I've observed here and come across is this quality framework that you've put together, a division, and I think it's excellent in setting a direction there. And in particular, it has some great tips for measurement in there, and I think those are the things that we should look at. The first one is outcomes and patient experience. So make sure we keep the patients as part of our measures and that we put the focus on outcomes. Second is make data available to everybody. So once we've invested in data collection, don't be keeping it to ourselves. Make it as transparent as possible so everybody can learn from it in doing that. Third is build the data collection into our routine work. So look for places that we don't have to create new processes to generate data, that we can learn how to let the care process itself generate the data. And I think a lot of the work you're doing with electronic medical systems now are doing that. And let's make sure that we get our data collected in that. And then present data from all these systems, present it in a way that encourages learning. Less emphasis on the targets when we're looking at the data and more emphasis on what is its performance relative to time? Does it look like common cause system variation or look like special cause variation? So you outline those tips in your framework, and I think those are excellent ways for people to get started with their data.
Great. Thank you very much, Lloyd, Provost, and talking with us today.
Thank you, Philip.